Hi, welcome back to Angelic Lift Wellness. I'm Dr. Olusegun. I go by Dr. O for patients that can't say that. Today we're going to be talking about high blood pressure. What is high blood pressure and how can you reduce your blood pressure naturally? So again, how to lower blood pressure naturally. That's the topic for today. So a lot of people throw that word around. I have high BP, high blood pressure, and they know this because the doctor told them they have high blood pressure. So what is it really? The numbers that we actually use to diagnose blood pressure has changed over time. And what used to be normal blood pressure nowadays can actually be considered high blood pressure. And the reason is because the Cardiology Association and the Diabetic Association have all decided that lowering blood pressure to a certain number reduces your risk of either having a heart attack or stroke or kidney damage. And so our diagnosis for high blood pressure has actually evolved over time. So before, it used to be that if your top number or your systolic blood pressure is over 140, that would be considered high. And your diastolic number, which is the bottom number, is over 90, that would be considered high blood pressure. So we'll tell someone if your blood pressure is 140 over 90 or higher, you're considered a patient with high blood pressure. And if it was below that, we used to call that normal. Well, in 2017, some of those guidelines were readdressed, and because we're seeing a lot of Americans with heart disease dying of heart attacks and strokes and kidney failure ending up on dialysis, that number we had to readdress and get it a little bit stricter. So now, actually, numbers over 130 on the top and over 80 on the bottom is actually now considered high blood pressure. So people that were considered normal previously are no longer normal. They're now in that high blood pressure range. Okay, so when I'm describing this to someone that's completely new to this, I like to explain what blood pressure really is. Okay, so think of your blood pressure as like the highway where the cars are kind of like the pressure that is driving through the arteries, which is the highway, if that makes it any easier. But this is really the way that your body supplies oxygen, nutrients, blood to your tissue. And it's got to go through this series of vessels that start from the heart where they're the biggest, and then it starts to narrow as it gets to the periphery, which is your extremities. And the pressure against those vessels is really what we're measuring when we're measuring this blood pressure. So the higher the heart has to pump to be able to push that blood from your heart to the tissue is that top number. So that's your systolic. While the number on the bottom tells us a little bit about after the heart has finished pumping that blood, how well does your heart relax, right? How well does it go back to the relaxed state to allow it to refill with new blood and then push that new blood out? So both numbers are very important. What pressure is it pushing against and how well is it relaxing when it is done pushing that blood out? Because a heart that does not relax very well, it's not going to refill very well. And if it doesn't refill very well, it's not going to push enough blood out to the organs that need it. So both numbers are equally important. We want both of them to be normal, not just the top or the bottom. We want both top and bottom numbers to be normal. So now that you know what blood pressure is, what makes it go up and how can we reduce it naturally? Well, the things that make it go up are usually eating the wrong food, holding on to too much excess body fat, stress, not sleeping enough, putting too much salt in the diet, and also there are other health conditions that can also make it that the blood pressure would rise. But let's just start with those few and go into how do we naturally bring blood pressure down? Well, a lot of patients don't like the idea of being put on blood pressure medicine because they know that once they are put on blood pressure medicine, this is something that they will probably have to take for the rest of their lives, right? So because of that, a lot of patients try to avoid getting to the point where they even need any medication, or if they do need medication, they want to quickly resolve whatever is causing the elevation so that they can come off of these meds. The other reason is these meds are not without side effect. A lot of them cause a lot of problems. I mean, we've seen patients where patients develop like this chronic cough after years of being on this medication. And sometimes they don't even realize that the cough is coming from the lisinopril until they go and complain about this cough that won't go away to their doctor, and they realize, oh, it's from your blood pressure medication. So those are examples of why we don't want to stay on prescription medications if we can do things naturally to bring blood pressure down. Okay, so let's talk about some of those things that we can do. Well, one of the things very easy to do is just eat healthy, right? Because if you eat healthy, lots of greens, lots of fruits, lots of vegetables, lots of water, you're probably not going to have the blood pressure problem in the first place, okay? So when we start to see problems with blood pressure, that is one area we call lifestyle change that we absolutely have to do. We just have to start doing better. Stop eating everything fried, stop eating everything fast, stop eating out, cook more at home, grill more at home, steam more, bake more rather than fry everything. Okay, so that's an example of something simple you can do. Just change the food that you're eating back to what it should be, okay? The second thing is to drink a lot of water, right? That goes without saying. When you start eating healthier, that's part of the regimen is to drink more water. Why? Well, because if you're not well hydrated, guess what your blood vessel has to do? It has to constrict, right? To try to help push more volume through. So if you just hydrate enough, well, your blood vessels will dilate and that will help the blood pressure come down. So hydrating enough is going to be very helpful. There's some also good thing about hydrating enough. You can actually add what we call green tea. There is some extract from the green tea that is actually very helpful in lowering blood pressure. So if you're tired of drinking just plain water, well, add a little bit green tea and that might be very helpful for your blood pressure as well. Now, exercise goes without saying, okay? Even though during exercise, your blood pressure can actually rise. But the end goal of exercising routinely and regularly is that your blood pressure will actually lower. In fact, a lot of times when we measure patients that are athletes, we measure their blood pressure and their heart rate in the office, we find that they have very low heart rate and very low blood pressure. And this is because exercise in time will help to lower the blood pressure, because the organs that you're feeding and the heart gets stronger, so that your need to raise blood pressure to get to those organs diminishes, okay? So exercise by far, next to eating right, will be the thing that you can do to help your blood pressure. What kind of exercise does it have to be? You know what? It doesn't even matter. Anything that gets you moving, okay? So we need moving at least 20 to 30 minutes every day, okay? And the movement has to increase your heart rate just a bit, right? So where I tell my patients that if you're still able to sing, you're probably not walking fast enough. You should be able to converse, but you shouldn't be able to like sing. So that's how you know if you're going fast enough with whatever exercise activity you're doing that will support lowering your blood pressure. So I love things that are not high impact. Things like swimming, things like walking, things like yoga, tai chi, exercises that have less impact on your joints but can still give you the full benefit of the exercise. So 20-30 minutes a day. It doesn't even matter if you do 10 of it in the morning, 10 of it in the afternoon, 10 of it in the evening. The research has shown that breaking up the exercise is still just as effective as doing it in a short time span. Okay, so it doesn't have to be all done at once. If your time does not afford for you to take a full 30 minutes or a full hour, do what you can. Add it up as long as by the end of the day, you've actually moved and gotten that exercise that you need daily. Okay, what are the other things you can do? We've talked about using nutrients, right? So sometimes we're not able to eat all the foods to give us all of the nutrients that we need every day. Sometimes your blood pressure will rise just because you don't have enough vitamins in you. So taking a multivitamin daily might be one way that you could use to help improve your blood pressure. So maybe your body is just low in one of the essential vitamins, and because you're not eating that food, now your blood pressure is high because of that. So just taking in a multivitamin can actually be helpful in getting that blood pressure better. What about sleep? Yes, adequate sleep. Now this one is kind of different for each person. There are people that survive and do really well on 6 hours of sleep. And there are others that until they get 9 hours, they are not refreshed, okay? So that is something that you're going to figure out for your body what you need. But in general, we usually say somewhere between 7 to 8 hours of sleep every night. For most people will be fine, right? So is it every night you're going to be able to get that? No. But for most nights, if you're able to get that amount of sleep, you should start lowering your blood pressure. And part of the reason is that during sleep is when a lot of the water shifts happens in the body. Water that is kind of surrounding your blood vessels, and your tissues start to move into the blood vessels and into the cell. And all of this starts to regulate and improve the pressure. So again, if you're not having an adequate amount of hours of deep REM sleep, that is not going to happen. So you have to really get those things in order, right? Making sure you plan to get enough sleep every day, okay? So the next thing is your salt intake. And a lot of people would have prioritized this and put it really high up on the list. But I tell patients, look, we actually cannot survive without salt. So I don't tell my patients not to use salt because they have high blood pressure. What we do is we figure out what type of salt they're using. How is eating salt getting into their diet? Because sometimes you're not necessarily hiding the salt shaker and pouring it on your food. It is because you're eating a lot of processed, highly processed and packaged foods. And this contains a lot of eating sodium. You don't even realize that there is so much sodium in these products. So you're thinking, well, I didn't add any salt to my cooking. Well, it's not coming from your cooking. It's coming from those packaged products that you are adding to your cooking, or packaged products that you're eating on days that you don't cook. So those are really the things that you have to become very avid label reader. And reading the labels, making sure you're keeping an eye on how much sodium you're ingesting every day. Like the average adult should not be consuming more than 1,500 milligrams of sodium, right? And just a package of ketchup is going to give you over 100. Right? And how much ketchup do some of you put on your food? Or so you can just imagine little places where sodium starts to get into our diet without even thinking about it. But also very important is the type of salt that we are adding to our food. I know there's a lot of like marketing kind of towards like, oh, Himalayan salt is better, or the sea salt is better, it's better than the table salt or the iodized salt. But at the end of the day, the amount of sodium in these things are pretty much the same. What we do recommend sea salt for is that for some people, it actually just gets into their blood vessel better. And the most balanced salt that we actually recommend is Celtic salt. Celtic salt is the actual natural salt. And it contains not just sodium and chloride, but it contains a lot of different minerals, over 50 different minerals. I mean, 80, I think, minerals. So there's a bunch of other minerals that we're supposed to be getting from our salt that we don't get when we just use iodized salt or we just use sea salt. So Celtic salt will actually help you balance and pull water into your blood vessel a lot better than just regular table salt. We cannot survive without salt. This is part of the way our actual cells work. Where sodium, potassium, there's got to be a balance between them to actually let the cell function properly, to make energy units, okay? So we cannot just say eliminate salt completely from your diet. What we want to do is use the right salt in the right amount to help us lower our blood pressure, okay? So the other thing we need to talk about is alcohol consumption. So alcohol is, of course, your body looks at it as a toxin. You could think about it differently. You might disagree with me on this one, but your liver processes alcohol as though it is a toxin. The minute the liver sees alcohol, it stops everything and goes and starts to detoxify the alcohol. Why does it do that? Because it knows that if this thing gets in the body, it's going to create a lot of havoc. It's going to cause brain damage. It's going to cause the blood pressure to elevate. So the body, the liver itself, immediately goes into detoxifying you the minute you drink alcohol. So reducing alcohol intake is, in general, is going to help you with your blood pressure. Okay? So also smoking. Right? A lot of us know smoking is not healthy, and most of the time patients are constantly talking about, I know I need to quit, I know I need to quit. Well, this is one reason to quit, is that if you're struggling with blood pressure and you are smoking, you are going to increase your blood pressure. So I get patients coming to me and saying, well, I don't smoke cigarette, I only smoke cannabis, and that's healthy. Well, here's the thing. The way we ingest cannabis also matters, right? Some people eat it, some people smoke it, some people put it on as a patch, some people put it on as a cream, some people take it under the tongue, some people take it as, you know, a edible gummy. And getting the cannabis in your body to help you with all of its anti-inflammatory processes, the analgesic effect, all of those are important. And if you do smoke it, one of the ways to think about it is, there are ways that you can smoke cannabis that does not put the combustion products into your body, right? We can use vaporizers that actually are going to prevent the combustion products from getting into our body. So we can still smoke it, but in a healthier way, if you will. So those are some of the things we have to think about. So if you're smoking cigarettes like tobacco or smoking cannabis, you have to think about what actually raises your blood pressure is the toxins that come from the combustion products that are entering your body when those products get burnt. Okay, it's not the medicinal part of the cannabis that we're worried about, it's the other part of it. So you have to use the right tools and the right formulation to get that medicine inside your bodies to be able to get benefit from it. So the other thing is reducing stress. We've talked about multiple times on this channel how stress can elevate blood pressure. And if you think about it, that's what stress should do, right? When you're faced with a stressful situation, for example, if you're faced with a lion that's gonna kill you, well, what you want your body to do is raise your blood pressure so that more blood can go to your eyes to open it up so you can see better. So more blood to go to your extremities, your feet, your hands, so you can run or you can fight. Right? So during an acute stressful situation, yes, we do want blood pressure to be elevated. But what we don't want is chronic stress causing an elevation in your blood pressure that now stays that way for years and years and years. Because what does that do? Well, that increases your risk for a stroke, right? What does that do? It increases your risk for blindness. What does that do? It increases your risk for kidney damage. What does that do? Right? So on and so forth. It increases your risk for a heart attack. So we don't want chronic stress because of the long-term effect on all the end organs. But reducing stress and de-stressing or meditating, stretching, doing exercises that lowers our stress level are going to be more beneficial and help our blood pressure naturally without medication, okay? What about those of you that like your pot of joe, okay? Coffee. Okay, so coffee, as I've mentioned in other videos, used in the right amount can be very helpful in boosting your metabolism a little bit and giving you energy to maybe get through your exercise routine and things like that. But drinking 8 cups of coffee a day, okay, now that's extreme, right? So, but there are people that drink a whole pot themselves every day, and that is too much for anyone. One of the things that you don't realize about coffee is that the ingredients inside the coffee bean are actually very dehydrating to your body. It actually pulls water from you. So when you drink 1 cup of coffee, guess what? You have to replenish with 2 to 3 cups of water to be able to get back to 0. So now imagine you drinking 8 cups of that. How many cups of water do you have to drink that day now to fix that? That's a whole lot of water, right? So reducing the amount of caffeine that you're drinking on a daily basis is going to actually help lower your blood pressure. So if you're someone drinking multiple cups a day and you're finding your doctor adding more and more medications to your regimen for your blood pressure, this is something you definitely want to think about, okay? So the next thing is to think about the foods that you do eat, right? They need to be rich in potassium. So I told you earlier that potassium and sodium, there's got to be a balance between them in the cell, right? For your cell to function normally. So when you're not eating foods rich in potassium, what's going to happen? Well, you're going to have high blood pressure because there's an imbalance, right? So and the way your body signals you to let you know there's an imbalance is by elevating your pressure, okay? So what are foods that are high in potassium? So things like banana, green vegetables like kale, right? Lots of strawberries and, berries. They're all rich in potassium. Watermelon is rich in potassium. So things like that. Now, and some patients just say, oh, can I just take a potassium supplement? No, because the way these foods give you the potassium is in a balanced ratio with other ingredients, other nutrients. So you're getting it in the best form that your body can absorb it and use it in a balanced state. When you start extracting individual ingredients and just taking them separately as supplements, you can start throwing some of these balances off. Okay, so you want to eat it in food the way it naturally exists. So one way to get a ton of potassium in your body without eating a bunch of food is actually just juicing, right? So we find that patients that want to lower their blood pressure, they start to juice natural fruits and vegetables and drink that daily, and their blood pressure starts to naturally lower, okay? The other one that we think about is magnesium. So magnesium is a supplement that you can take that can be very helpful in lowering blood pressure. In fact, a lot of OBGYN doctors will tell you that when a woman comes with preeclampsia or eclampsia, which is a situation, a very, very risky situation when a woman is pregnant, they find that by giving them magnesium, they can really drastically reduce the blood pressure elevation that happens with this condition. So magnesium in itself, we use medically. Okay, it's not just a supplement that you can find over the counter. We use it in hospitals, we use it in the clinics, because we know that its effect on the smooth muscle inside of the blood vessels can actually lower the pressure, right? And it's very good for your muscles. It relaxes you. It helps you with bowel movements. It helps you with soreness and joints, aches and pains. And it's so very helpful for a lot of metabolic processes in your body. So it also helps in lowering blood pressure. So those are some of the things that you can do naturally to help you bring your blood pressure down and not have to take blood pressure prescription medications for the rest of your life. I hope you can implement some of those. Even if you can't do all of them, pick the ones that are easier for you to implement and start implementing them, and just watch how your pressure starts to improve. Make sure you're checking your blood pressure at home every day, first thing in the morning, and recording it. And that's the only way. Checking your blood pressure only once a year at your doctor's office, I mean, come on. We check the engines in our car more often than that, right? So we change the oil in our cars more often than that. So you definitely want to check this engine, this body of yours, more than once a year. Get those blood pressure machines from the grocery store, and check your own pressure at home. First thing in the morning, before you do anything, before you drink anything, before you get faced with traffic on the way to work, you want to check what that pressure is and start recording it, because that is going to be a better indication of what your real pressure is, rather than the one you check randomly in the afternoon at the doctor's office. Hope this has been helpful. Comment in the section below if you have any other tips, anything that you do to help you lower your blood pressure that I might have not mentioned. And if you disagree with any of the things that I said here, I'd like to hear that too. I'd like to hear your opinion. I learn every day. I would like to learn what you're doing, maybe something that you do culturally, maybe something that comes from your part of the world that helps to lower blood pressure. I know that some people believe in garlic. Those are some things that some people use. I'm not a garlic fan, but you know, to each his own. So that's something somebody else might be using to help lower their pressure. But if you're doing that, make that comment in the section below and I would love to read it. I'll see you on the next one. Bye.